a few moments ago. Let's turn now to Maria Caulfield, the Health Minister, who is listening to that. Good morning to you.
Good morning.
It's a rise of roughly 3% to this year's offer. That seems to be what has managed in Wales, not to end the strikes, but to at least get them postponed and not to happen today. Why can't you do the same in Westminster?
So the offer in Wales is 3%, but it's only actually a 1.5% pay increase and then another 1.5% lump sum payment. And that is being put to members in Wales. A much higher offer was put to members in Scotland before Christmas and was rejected. So we're by no means in Wales out of the woods in terms of a deal being done.
But it has prevented the strikes today,
No,
and you could have done the same. The argument.
So we're in a similar place to Scotland where we want to discuss the forthcoming year, so from April's pay rise, and that's what they've done in Scotland, and the RCN have suspended strikes there. And I would say to Pat, who I respect hugely, that, you know, if that's good enough in Scotland, if we're discussing the forthcoming pay review from April in England, could the RCN suspend the strikes and get round the table, as she suggests, and reach a negotiation? The unions have actually pulled out of the independent pay review body process and say they will not submit evidence. I think that's deeply unhelpful if we're going to try and get a resolution to this.
Are you saying you definitely will not discuss this year's pay offer, any increase to this year's pay offer with the RCN under any circumstances?
Well, I think the Prime Minister's been very clear. We have got an independent pay review process that does look at a range of factors, including inflation, and inflation was predicted to increase when those arrangements were made. And the unions actually accepted that offer at the time. And, you know, our difficulty is we've got to manage the purse strings as well. And for every 1% increase in a pay rise in the public sector, that's around £700 million. So we have to find that from somewhere. And we're busy trying to fund, get the backlogs, dealt with. We've managed to deal with the people waiting for 2 years or more. We're now on track to end those waiting 18 months or more in April. And that's where our funding's going, into patient care.
Is it still the case that you are arguing that it would fuel inflation? And if so, what's the mechanism?
Well, there is the argument that it would fuel inflation.
But how?
I mean, that's if we give above inflation pay rises, it would fuel inflation, because we know that from previous experience.
But how, though? Because the point is made by economists that you don't pay for those pay rises by raising prices as you would in a private sector organisation. So what is the mechanism where it fuels inflation?
Well, it's not just about fueling inflation, it's about paying for it. You know, as I indicated, every 1% is about 700.
It's not that it fuels inflation, it's something else.
It's a combination of both. So if you give above inflation pay rises, that would fuel inflation. But we're talking about, you know, in Wales, they've got 3% on the table, but we have to pay for it. And at the moment, we are borrowing record amounts of money. We're seeing interest rates that have gone up because we've got record levels of borrowing. And so it's the whole financial picture that has to be taken into consideration. But what I would say to Pat and the RCN, as that's happening in Scotland, they've called off the strikes to discuss the forthcoming year's pay settlement from April, which is just a few weeks away, and to do the same in England, call off those strikes. The Secretary of State's been meeting in January almost on a weekly basis with a range of healthcare unions, so the door is firmly open, and I would ask the RCN and the ambulance unions to get back round the table.
So if say they said yes to that, okay, we are willing to talk about next year, but we want as well to open the door to talking about this year. Is that at least a possibility?
Well, you know, the Secretary of State and the Prime Minister have been clear that would be extremely difficult to do, because it wouldn't just be for nurses. You know, you would have teachers saying, could we reopen this year's pay settlement? You've got ambulance drivers, you've got rail workers. You know, there's a range of public sector workers who would also want the same request. And across the board, you're talking about billions of pounds to pay for that. And we want to put that into frontline services as we are doing now, but we also are accountable to the taxpayer. You know, we hear taxes are at a high level and people are struggling with that. We do believe it would drive inflation forward if we've got inflation levels, pay rises. And the Prime Minister's focus is to get inflation down. We're on the cusp of seeing that happening. The last 2 months we've seen small drops, but we expect much more drops this spring, and that will put money in people's pockets as well. There's no point having a 10% pay rise if inflation is above that, because it absorbs all the money that you get in your pay packet. And the best way of getting more money into people's pay purses, pockets, bank balances is to get inflation down. And we are on track to do that. And we don't want to lose that opportunity by having to borrow more money to pay for pay rises.
Caulfield, thank you.